An age-old tradition has it that in the fields and villages of this country, a group of knight-errants have always roamed about masterful in the art of healing and subduing monsters to save villages, bringing benefit to the common people of the town. They vary in appearance and gender, each has their strong points, but they all share one common trait. And that is going barefoot. Not the so-called barefoot immortal, but the legendary barefoot doctors. As the common saying explains well, illness must be cured. China is an agricultural world power with a rural population that to date still exceeds the urban population. The difficulty and expense of visiting the doctor is not only a headache for urban dwellers. Rural villages have been concerned for several generations. In the early days of the establishment of the nationalist government in Nanking, there was once vain hope for complete government responsibility for the health of all people, but the nationalist government experienced a shortage of funds and provisions disturbed by domestic trouble and foreign invasion. In the end, this gradually became an unattainable dream. Following the founding of New China, the thinking behind the constriction of the healthcare institution was also given new life. The path of cooperation was put forward. As early as 1945, Chairman Mao had pointed out, so-called public health leaves behind 330 million peasants. What's left is basically idle talk. The nation belongs to the people, so of course national construction depends on the people. Healthcare is no exception. In 1958, People's Communes for the first time trialed a policy that involved the collection of cooperative medical service membership fees, while seeking medical advice would not incur further fees. Henceforth, the rural cooperative medical service walked onto the stage of history. Remember the barefoot doctors. Burning incense and worshipping Buddha when a villager fell ill was a common occurrence. But Buddha only said it'd be better to give up treatment. These half-farmer, half-doctor barefoot doctors fell as if to fall from the sky, assembled an army from nothing, with a silver needle to cure all diseases, a loyal heart to warm 1,000 households. Though unofficial doctors, they, along with the cooperative medical service system and the rural health stations, became the three talisman in relieving the extreme insufficiency of doctors and medicines. Later, the success of the marketization reforms led some to mistakenly believe that everything should just be marketized. As a result, the healthcare system was also taken on down the wrong path. Rural residents once again were burdened with self-funded treatment. As the burden became greater, doctor-patient conflicts rapidly increased. In fact, lessons of this kind are abound in Western countries. As a matter of fact, Obama put forth medical reform just after assuming office. 8 years later, and he's fainted crying on the toilet. In 2002, the central government made the decision to establish a new rural cooperative medical scheme. So, what exactly was the new medical scheme? For example, Mr. Zhang is a diligent and sincere rural resident. Participating in the new medical scheme, he will pay an annual insurance fee to the village committee. Should Mr. Zhang fall ill, he need only bear a fraction of the cost himself. The remaining amount can be submitted for reimbursement. In another example with the same diligent, sincere Mr. Zhang, albeit from an extremely impoverished family, when he sees the doctor, he can receive further reimbursement for medical expenses. If the financial difficulty index reaches a certain level, he can even receive a full reimbursement. In short, minor illness warrants a smaller reimbursement, while serious illness will warrant a larger amount, being fully prepared for serious illness and reduce the issue of poverty caused by illness. This is the policy orientation of the new rural cooperative medical system. But if we reimburse everything, the rural insurance fee alone is obviously not sufficient. After rural residents pay their insurance fee, the finances are universally administered at the county level, forming a reservoir of funds specifically to pay for rural medical expenses. If the reservoir does not suffice, then the government will guide the raising of resources from various avenues in order to increase the funds. Individuals, collectives, government, and all categories of dedicated funds. All together thinking of solutions to help each other. This is what cooperation is about. At present, China has already realized complete coverage of rural cooperative medical services. This medical reform plan, renowned internationally among those in the profession for being the most broad, significant, and exciting plan of its kind, is currently providing a growing number of rural residents vigorous medical guarantees. Of course, this is not without problems. The specified individual fee and the actual ratio of reimbursement is not consistent across regions. Barriers to cross-border and cross-province reimbursement still exist, and the accompanying medical network locations and infrastructure remain insufficient. Especially, it must be pointed out, how to ensure that the finite funds are used practically on healthcare for rural residents, and not fraudulently acquired by means of exorbitant drug pricing and deceitful diagnosis. Oversight also needs to be strengthened and sectors straightened out. Only after this can we hope to gradually turn the difficult and expense of getting medical care into a once-upon-a-time legend.